Relieve pelvic pain at home. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. Today in this Ed Talk, I want to give you 3 easy tips that you can use at home if you're experiencing pelvic pain. So the type of pelvic pain I'm talking about is like down low. I hear a lot of my patients when they come in, they have pelvic pain. They talk about pain right here, kind of in the inside of their butt that sometimes comes forward. It might be pelvic pain that feels like it, if you're a woman, that it just feels like it's vaginal or that it's even inside or even, close to that area. So that's the type of pain that we're going to talk about today. And I'm going to give you some really easy tips that you can use to hopefully get a little relief at home. So let's get started. Tip number 1 is to do a myofascial release for your pelvic floor muscles. To do that, you can use either a soft inflatable ball like this. This is something I give to all of our new patients. So they have this at home. But you can use like a little playground ball, something that's squishy. And ideally, I like one that you can either let some air out if it's a little too firm, or that you can pump it up if it happens to lose some air. Alternatively, you could try a tennis ball. I like a tennis ball because it has some give to it, but it's firmer. So you're going to get different results here, and you can see how they're different sizes. So grab a ball. I'm going to teach you how to use that here in just a moment. But first, I want to show you where exactly we're going to place this ball and give you some additional steps there. So I'm going to grab my pelvic model here, and basically this shows the muscles, okay? And I'm going to show you on this, as well as my bony model without the muscles, on exactly where you want to place this. So if I turn this around, you're going to see where the back comes down and we meet up with the sacrum here, this triangular bone. And if we come underneath, you can see these sits bones up underneath. So like I'm sitting right now, and if you're sitting as well, if you place your hand up underneath, you're going to come to this sits bone. Okay, this is part of the pelvis, and you can see here how, if I tilt this up, you have your tailbone here, and you have all of these deep pelvic floor muscles that come and attach into here and go to that sacrum. You can also see more of these superficial muscles closer to the surface of the skin. You can see how they go around the anus and they come forward towards the vaginal opening. So we're going to want to place the ball into this area on one side, I would suggest. Okay, so again, this is to help relieve pelvic pain that might be coming from the inside of that sits bone, might be coming forward, or honestly, it might even be coming back. You might be feeling some rectal pain or rectal pressure. Okay, and if I show you this from the front, again, there is the sits bone, and these muscles, as we come forward, you might be able to see that a little bit better. Again, vaginal opening there, and you can see the deep pelvic floor muscles in there. So we're going to get started with this technique. I want to show you really quickly on this, just the bony model of my pelvis. So we're finding that sits bone underneath here. This one doesn't have the muscles on it, but we're going to place the ball between that bone underneath and the edge of the tailbone. Okay, and we can do this on either side. So you can see how the tennis ball can fit in there, or the inflatable ball. So I'm going to turn around and show you exactly where I would place this. So here we go. I'm going to use the soft ball first. So I'm just going to turn around, and you don't necessarily need to do this on the floor, but just because I want you to see what I'm doing, I'm going to show you on the floor. So I would lift this hip up on my right side, find that sits bone underneath, that hard bone, right? And I'm just going to rest my body on top of the ball. So I'm sitting on it. Okay, so that's one way. I'm going to give you some more instructions here, but otherwise, I could use this tennis ball. Obviously, it's going to be a lot firmer, but I can find that same spot. And you could even roll a little bit and really find where the tender area is for you, or where you're having some sensitivity or soreness. Ideally, we don't want to be causing a lot of pain for you, okay? So find an area that feels tender, sensitive, or sore. You don't have to be directly on it. You could even be a little bit off of that, okay? So play around with it a little bit, kind of move your body and find where it feels good, and then try to rest your body over top of the ball and let the ball get into that area and let it soften and let go. With a myofascial release, we really recommend that you hold for a minimum of 3 minutes, or 5 minutes or longer. So 3 to 5 minutes is good. If it feels okay, you can go longer than that. But with a myofascial release, because we're targeting the fascia or the connective tissue, it takes a little bit of time for that to respond to the pressure that you're putting into your body. So don't rush through this. And I would also tell you, like I said earlier, you might not want to start on the floor. It's pretty firm. I'm only showing you here because I want you to really see where the ball was placed. But ideally, I tell my patients, start on a soft surface like a couch or an easy chair, okay, or a bed. Those are good surfaces to start with, okay? So give that a try and we'll move on to tip number 2. Tip number 2 is to do some stretches for your inner thighs and indirectly for your pelvic floor. I personally prefer to use a wall, or you could use the back of a door. You just want some wall space or door space so that you can get your legs up onto the wall, and we're going to do some stretching for the inner thighs. So to do that, I'm going to show you, I'm going to get as close as I can to this wall, and I'm going to turn and bring my legs up onto the wall. So I prefer to come down onto my side, get my butt as close as I can to the wall, and then I'm going to just roll and get the legs up the wall. Now, depending on your flexibility in your legs, you might not have this much flexibility and your knees might feel like they're bending, okay, if your butt is on the wall. So in that case, I would push yourself away a little bit. You want to ideally have the knees straight and your bottom as close to the wall as you can get. From here, you can stay here, but it's ideal to open up the leg some as far as you can, leaving the heels onto the wall for support. And then you're going to start to feel a stretch into the inner thighs here. Okay. From here, once you feel a stretch, you can just relax and do some breathing where you're kind of breathing and allowing that breath to come down into this area as much as you can, and reminding yourself to really relax your muscles. So no clenching. You really want to try to get the muscles to relax without bearing down. So I would recommend spending 3 to 5 minutes here. So we're getting a myofascial stretch. You could also alternatively bend the knees and bring the knees open. So we're in a kind of modified happy baby pose. A lot of people recommend happy baby like this, but that can be a little hard for people to get into that position. So using the wall gives you a chance to have your feet supported, but you're still getting that inner thigh and pelvic floor stretch. So again, you can spend some time here. You can bring your legs down a little bit, your feet towards your bottom a little bit, gives you more of a stretch. So play around with that on what your body feels good with, on how open your knees are, and how far down your feet are towards your bottom. Again, holding this for 3 to 5 minutes, relaxing into the floor, into your body, and doing some breath work. Tip number 3 is to try a guided meditation. And I want to gift you a pelvic bowl meditation that I have personally used with my patients as well as my clients. So I'm going to put a link to the pelvic bowl meditation in the description of this video. So check that out and use that and see what kind of insight that will give you in your ability to relieve some of your pain at home. If you want more of a customized plan for your pelvic pain, or you want some more guidance, perhaps you have questions that you want answered that are specific to what's going on with you, we would love to help you out. You can head to our website, healingspotpt.com, request a discovery session, and you'll meet with a member of my team and let us help you decide what the next best step is, whether that be working with us one-on-one in our office or online, or maybe taking one of our online courses. We would love to hear from you and be a source of great information and guidance for you. Thank you so much for watching this Ed Talk. I'll see you on the next one.